Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom to two girls. And one thing that we don't learn a lot about in residency in pediatrics is potty training. I'll be honest. We know a few of the important things when it comes to being physiologically ready and developmentally ready, but how to actually go about potty training is something that I had to personally read about when it came time to potty train my oldest daughter, and I'm hoping that this video will be a resource for you guys. So potty training can seem incredibly overwhelming. It can seem very daunting, especially for you as the parent, because you're hoping that it goes smoothly, you're hoping that it goes quickly, but it's not a switch that you flip on and off. See, children need to developmentally be ready, but also need to learn a whole new pattern. Just like when your child was learning to use utensils to eat, it wasn't like you put a fork or a spoon in front of them and they got really good at it after one day. No, instead, it takes repetitive practice, reminding, showing them, encouraging them, clapping for them, and seeing that they actually have some interest to want to feed themselves. It's kind of the same thing. With potty training, they have to kind of show some interest, perhaps, look at you as the parent, see what you're doing, also be able to show some interest in wanting to do this themselves potentially, and then there's going to take a lot of encouragement and practice along the way. There are also going to be some mishaps, and that's okay. So let's talk about what are the developmental milestones as a pediatrician that I look for when it comes to potty training. Now, it is important to note that in this country, in the US, typically we say potty training is around 2 years of age. Some children might be closer to 18 months, and some children might be closer to 3 years of age. That being said, there are some cultures that start potty training very early, within the first year of life, and that is awesome. That's excellent. Some of those cultures actually practice the same techniques in this country, and excellent. I have no problem with that. But that being said, for many of us parents, we may not be able to dedicate that type of time to be able to put baby on the potty every single time they have to go. And it's okay if you choose to wait for the usual normal range in this country of about 2 years of age. So why is 2 years of age such a helpful landmark? Well, usually somewhere between 20 to 30 months of age, your child begins to show signs of physiologic readiness. That could be remaining dry for at least 2 hours at a time. That's actually really important because newborns might be urinating very consistently small little amounts throughout the day, but as your bladder matures and grows larger in size, it's actually able to hold larger quantities of urine. So when you're going to urinate, you're actually going one volume at a time, and you're not sort of going throughout the day or little bits at a time. That's really helpful, especially when it comes to trying to potty train your child. Now, more than just bladder maturing, gross and fine motor skills are very important too. Around 2 years of age, your child is at least able to walk independently. They're also able to squat, and so that's very helpful because obviously when you're urinating, stooling, your child's going to be needing to squat. Now, ideally, they might be showing some interest in undressing themselves, at least being able to try to pull their pants down, not even being successful, but at least that's something that you can help them with, and they have some interest in being able to undress themselves. Now, that typically does happen around 20 to 30 months of age, especially close to 30 months of age. And then one big developmental milestone we haven't talked about is the ability to communicate. So by 2 to 3 years of age, your child is at least able to communicate and let you know that they need to go use the potty. A child under 1 may not be able to do so, so you're having to watch their subtle cues very, very carefully. But hopefully by 2 years of age, your child is able to communicate those bodily needs. Okay, but what happens if your child doesn't communicate with you that they need to go potty? Well, I usually tell parents this is very normal, and in the first couple of days, even the first couple of weeks, months, maybe you're trying to actually schedule potty breaks. A great time to do this would actually be right after meals. There's such a thing called a gastrocolic reflex, so right after you eat something, you might be tempted to go to the bathroom. Now, whether that's just for pooping or just peeing, it doesn't make a difference. If you kind of add it in and create a routine, it will start to stick for your child. So I usually recommend bringing a book. You might sit there for 10 minutes and nothing happens. That's okay, but the day that it does happen, over the top excitement. That's super important. Trying to give positive encouragement and good feedback when they do the thing that you want them to do is very helpful on the potty training journey. Now, on that note, what happens if there's an accident? Because accidents will happen. The way you respond is likewise very important. I would really highly recommend you don't switch to scolding or negative talk. This was an accident. Even if children happen to do it on purpose, because some children do have behavioral regressions and, having accidents and having them happen in a public place or soil their pants or their underwear, that's unfortunately one of the ways that they can have tantrums and act out. But it's really important not to lose your cool about these types of accidents, because you could end up actually causing a negative association to potty training or using the toilet. If an accident does happen, remember, try to be patient and try to go back to them about, well, what did you feel? What could we have done here? Maybe we could go to the bathroom before we leave. Or maybe when you get that little urge that you really have to go potty, why don't we go potty? We could just constantly sort of reinforce, and it's okay. Sometimes my own daughter, when she was potty training, would have an accident while watching Mickey Mouse Clubhouse because she simply didn't want to get up and go potty. And that's okay. I know it's frustrating, but then we talk to them about why it's important to listen to our bodies. And trust me, some kids may hate sitting in a wet underwear or wet pants, and some may not mind it at all. It's nothing against you or you as a parent. On that note, how do I feel about pull-ups? Well, this can be actually pretty controversial in the whole potty training world. Some parents say pull-ups are bad. You're essentially reinforcing them that it's okay to pee in a diaper. It's just basically a diaper you can walk around in. You should just switch completely to underwear. And some parents think it's okay, especially if you are easing your way into it, and it definitely does help with cleanup. I'm kind of 50-50. I think there's worse things that you could do when it comes to parenting, to be honest, and sometimes it might be really convenient if you're traveling to do a pull-up rather than have to deal with an accident if your child is still potty training. Now, you could always say this is special underwear, or you could always go out and buy underwear, and there are certain potty training underwears that are a little bit thicker cotton, and they have a more absorbent cotton area where they would void or urinate, so that's an option too. And on that note, to get your child pumped up and ready for potty training, consider taking them with you on these errands to go buy the underwears. Maybe you could buy Paw Patrol, Minnie Mouse, Barbie, whatever it may be that interests your child, and it makes it just a little bit more exciting. Okay, last little bit I want to mention is how long it can take. You're going to see a lot of books out on the market that say potty training in 3 days, or get your child potty trained in a weekend, and I am not a fan of them, to be honest. I think it's a lot of pressure on you and the child, and I think it's okay if it takes longer than 3 days. In fact, it's normal for it to take 3 days. This isn't like sleep training a baby when they are 6 months of age. This is very different. This is teaching your child a whole new life skill, and that does take time. And in general, if you push something too hard on a child, they will inevitably push back, and it may backfire. So you don't want things like stool withholding patterns, or like we mentioned, urinating out of a tantrum, or trying to cause behavioral regressions. You want this to be as positive of an experience as you can make it. So I usually say try a few months before you really want to start potty training to put your child on the potty. And again, you could do it right after meals, a few times a day, or maybe just once a day, and let them get used to it. If they end up going, great, make a big deal out of it. Reward systems, I don't know, some people might say this is not the best thing, but I think reward systems in moderation are totally okay. I would not go buy your child a Barbie dream house or a huge Lego set after one urine in the potty, but maybe you could buy, a big tub of cars and give them one car after they've done poopy in the potty, or likewise maybe like 2 M&Ms or something. So you're not really causing a huge uproar amongst the dentist community either, because we don't want to give them so many sweets and an unhealthy diet, but definitely encourage them along the way. So whatever reward system you come up with, I'm not completely against it as a pediatrician. Now, some parents and some potty training experts might be completely against it, but I honestly think there's worse things. And the second little bit to that is how long can it take? Well, I personally think daytime potty training and nighttime potty training are two totally different beasts. You see, to become nighttime potty trained, not only does your urine need to be held overnight, but your body and brain need to really respond to the signals from the bladder. So the bladder sends a signal up to the brain to say, hey, I'm getting full, you need to wake up. And the brain needs to respond to that and either wake up or you have an accident. Some children might be ready to do nighttime potty training super early, and some may not be. Generally, as a pediatrician, I don't advise you, being the parent, to go into the room and wake up a child, because you then create a dependence on yourself. You're disrupting your sleep as well. In that case, that's why I think pull-ups aren't the worst thing, and they do help sort of in the nighttime potty training realm. Your child can definitely just switch to underwears and have some wet bed sheets for a period of time, and you kind of do it the hard way and sort of get through it. And after maybe a month, you can see how many wet periods you do have at night. And definitely there's different things you can do, like cutting out fluids at night or making them a little less. But it's important to know that this is not all your child's fault, because if they have accidents at night, it could be just that their brain's not really getting the signal and waking them up yet. There's also hormones that your body produces that your kidneys respond to actually make less urine at night. So there's a lot of different complicated aspects here. Family history can weigh in on nighttime bedwetting. Genetics, constipation is a huge one. So there's a huge list of things that could go through when it comes to nighttime potty training. And if you have questions, I highly recommend you direct them towards your pediatrician so we can work our way through that complicated topic. I don't think you necessarily need to do nighttime and daytime at the same time if you don't want to. If you do choose to do so, it's actually probably more beneficial for the child, but it is a lot to take on. And that's okay as a parent if you are not ready for that. Okay, I hope this helps. If you have questions on potty training below, make sure you ask them. I'll do my best to answer. This is a little bit of a complicated topic to answer sort of virtually. So these hit all the big bells and whistles. If you have other questions, what I'll try to do is compile them and maybe make a second Q&A video. All right, stay tuned, and I hope you come back for a next video. Bye.